Former Michigan U.S. Senator Debbie Stabenow says our state cannot afford to go backwards when it comes to mental health care. Today, she joined families and healthcare providers to rally against a new proposal from the Michigan Department of Health and Human Services.
Supporters of the plan say it could streamline mental health services, but critics warn it may privatize the system and limit access. News 10's Rachel Fulton shows us what this proposal looks like.
Today, families, advocates, and providers stood with Senator Debbie Stabenow, urging leaders to stop a proposal they say would privatize the state's mental health system.
This is comprehensive health care. If somebody has a situation where they need to take a medication to balance off a chemical imbalance in their brain, we should do that no differently.
Opponents say the proposed bid-out process would replace Michigan's public mental health care system with private insurance plans, raising costs while limiting care.
In Michigan, we spend $1.5 billion on behavioral health services. This is taxpayer money, and it is used to pay for the health care services, the behavioral health services of some of our most vulnerable Michiganders.
For those living with mental health challenges, the debate feels personal.
I was late diagnosed with autism. I had no clue, but that completely changed my life in regards to how I operate from day to day.
Here at the Capitol lawn, thousands are rallying to share their stories. And families here say that this fight isn't about politics. It's about making sure that the care they depend on remains accessible in their communities. State leaders argue the shift will improve consistency, ensure timely access, and provide a simpler system with less bureaucracy, while actually reducing barriers to patients. But for many here, they want reforms that strengthen public care, not changes that they fear will limit access. In Lansing, Rachel Fulton, News 10.
The Department of Health and Human Services says these proposed changes are a direct response to feedback and requests from people receiving mental health services in Michigan. The proposal is still under review, and lawmakers will likely hear more testimony in the coming weeks.
Michigan State University's